The previous modules in this series focused on managing the road to recovery before you start cardiac rehabilitation. This module shifts the focus to how you can manage or change risk factors. What causes us to get coronary artery disease? Some risk factors we can't change: age, family history, and ethnicity, for example. Some we need to control: high blood pressure, high cholesterol, diabetes, and weight. Some factors we can change: nutrition, physical activity, smoking, alcohol intake, stress response, and mental health. To keep your heart healthy and prevent problems from recurring, it's critical to take control of as many risk factors as possible. The factors you need to control: cholesterol, high blood pressure, overweight, diabetes, all put excessive demands on your heart, either by making it work harder or by clogging arteries so that blood doesn't flow as well through your body. If you are on medications to address these conditions, your healthcare team will have reviewed them before your discharge to ensure that they are supporting your recovery. In the weeks to come and on through the cardiac rehabilitation program, you will also want to consider making lifestyle changes to what you eat, your physical activity level, your social connections, all to support a heart-healthy lifestyle. Your patient guide contains additional guidance on heart-healthy living. The Roadmap for Life Changeable Risk Factors sets out goals for key risk factors and resources to help you achieve them. The roadmap has space for you to note your results and compare them to the goals. Bringing the roadmap with you to medical appointments will help you reach your goals. Smoking damages the lining of the arteries, making it easier for substances to stick to the side and build up. It also makes your blood stickier, which can form clots and block the arteries. Research has shown that quitting for 1 year reduces your risk of another heart attack by 50%. If you smoke, quit. Quitting smoking is hard. The Heart Institute has an excellent quit smoking program that is available to anyone. You can get their support. If you live with others who are smokers, they can also participate. Contact information for the program is in your patient guide and stoplight chart. Obesity management is more than just reducing numbers on a scale. It's about improving your overall health and well-being over the long term. Obesity is a chronic condition and requires long-term management. The Heart Institute offers nutrition and activity programs that can help you. You can explore these once you begin cardiac rehabilitation. High blood pressure can damage the inner lining of the arteries, which makes substances stick to the side. Over time, this can cause a thickening of the inner lining of the arteries, narrowing them to half their size. So it is very important that you know your blood pressure target. The targets set out on the stoplight chart are for when your blood pressure is taken in the doctor's office. For people without diabetes, the target is below 140/90 in the doctor's office or 135/85 at home. For people with diabetes, your blood pressure should be below 130/80 in the doctor's office or 125/75 at home. If you're not sure which blood pressure target applies to you, ask your doctor or healthcare team. Your cardiologist or surgeon may want your blood pressure lower than the usual values. Check with them. If you track your blood pressure at home, bring this information to your doctor. Having a blood pressure cuff at home is a good idea. Some of the medicine you are taking can affect your blood pressure. Following heart-healthy living guidelines can also help you manage your blood pressure. Improving nutrition, regular physical activity, managing your emotional health and stress, all of these can influence your blood pressure. If you have coronary artery disease, you'll need to stay on cholesterol medications for life. The most important reading is for LDL cholesterol, what is often referred to as bad cholesterol. The target is to get it under 1.8 mmol per liter. Cholesterol medications are important for 3 reasons. Most of the cholesterol is made by your liver. It doesn't come from what you eat. Sometimes this is related to genetics. Whatever your cholesterol is today, it wasn't good enough to protect you from developing coronary artery disease. So it is important to lower your LDL. Finally, cholesterol medications help to prevent cracking of the plaque in the artery. and can protect you from another heart attack. Lipitor and Crestor are two popular medications used to lower cholesterol. In most cases, your family doctor will be testing your cholesterol levels and making adjustments to your medications as needed. If you're having a reaction to a particular medication, talk to your family doctor. If your pancreas is not producing enough insulin, or your body is not using insulin properly, an abnormal amount of sugar or glucose can build up in our blood instead of being used for energy. Insulin is the hormone that unlocks your cell doors to use glucose, the fuel for our bodies. Excess glucose in our arteries can contribute to blockages that cause damage throughout our body. All patients who have been admitted to the Heart Institute are screened for abnormal glucose using a non-fasting blood test called hemoglobin A1C, or HbA1c. This test measures the amount of glucose that has stuck to the hemoglobin in your red blood cells. This level is a good indicator of your average blood glucose level over the past 3 months. This test is not just a diagnostic tool, but also a way for you to know how well you're controlling glucose. And the lower the number, the lower your risk of complications. It's important to know your number. About 60% of our patients have abnormal glucose in their blood, and 25% don't even know. An HbA1c less than 6% is in the non-diabetic range, which means you are well controlled. Keep up the great work. An HbA1c between 6% and 6.4% indicates you have prediabetes. You need to take steps, including healthy eating and increased physical activity, to delay or prevent type 2 diabetes. An HbA1c of 6.5 or higher indicates you have diabetes. If you have diabetes, you need to keep this number below 7% to decrease your risk of long-term complications. Heart disease is the leading cause of death for those living with poorly controlled diabetes. If you are waiting for surgery, you want to have the best glucose control possible to decrease your risk of infection and to promote healing. If you don't have a diabetes team, we can consult with you by phone to help improve your glucose control. During your hospital stay, you may have met with the inpatient diabetes nurse educator who worked as part of your team to ensure you have the best possible glucose control. If you have prediabetes or diabetes, you will have been referred to a community diabetes education program for post-discharge care. This will be arranged close to your home, where you can meet with diabetes educators one-on-one or in group sessions to learn more on how to manage this progressive disease. If you have diabetes and your HbA1c is greater than 7%, you will have been referred to our diabetes clinic in the Heart Institute. Post-discharge, if you don't have a diabetes team, you will be monitored by an endocrinologist and our diabetes nurse educator. Our diabetes clinic offers a 1-year intensive management program that ensures you receive the correct medicines to get to target before you were discharged, along with a detailed diabetes management plan you will follow with your family doctor. Our automated telephone system calls you regularly for up to 1 year to ensure you are following the best possible management practices. If needed, our diabetes educator will follow up with you by phone. Our diabetes nurse educators are available in person and deliver phone counseling until you start working with your team in your community. This module focused on managing health condition. The next module touches on heart-healthy living habits that reduce the risk of future heart problems.